my name is Dr. Jennifer Berman. I'm a urologist and sexual health expert, and I want to talk to you about vaginal rejuvenation. Specifically, the difference between Votiva, this is a Votiva probe, versus MFEM 360. There's a lot of options out there, a lot of different technologies and different machines. I believe radio frequency heat, which both of these devices utilize, is the best for improving vaginal health, vaginal lubrication, as well as the appearance. The difference between these two treatments, the Votiva by InMode versus the MFEM 360 by BTL, is simply in the electrode. So with the MFEM 360, as you can see, the electrode goes all the way around the circumference so that anywhere the probe is placed within the vagina is being touched. So every nook and cranny, every bump, every lump throughout the whole length of the vagina is being treated, okay? So this can be done. The cool thing about this treatment is it can be done by a medical assistant. It doesn't need to be a doctor. They've made it pretty much dummy proof. It's very safe. It doesn't get too hot. It shuts off. Can't burn anyone. So it's easy to do. Covers the entire, length of the vagina and has the 360. Votiva, this is a Votiva probe. The Votiva, as you can see, the electrodes are only on the front surface here, not on the back. So this requires some precision and experience and knowledge by the examiner or doctor. This cannot be done by a medical assistant. It has to be done by a doctor or a nurse or nurse practitioner. So in the vagina, if this is a vaginal opening, you can see that the probe has to be placed precisely where you want to treat. So if the examiner misses a spot or doesn't do it right, there's that. But the cool thing about the Votiva, in contrast to the MFEM 360, is that I can target specific areas. So for incontinence, I can specifically target the pubocervical ligaments, the upper aspects of the urethra, the things that support and lift the urethra in women with urinary incontinence. On the outside, I can target if a woman is experiencing arousal issues or difficulty achieving orgasm. These treatments cause neoneural, new nerve, and neovascular rejuvenation. So I can target the dorsal nerve of the clitoris, the posterior branch of the labial nerve, the erectile tissue around the urethra, around your pee hole. There's erectile sexual arousal tissue that surrounds that. I can target that. So depending on what the patient is experiencing, what symptoms she's having, what her goals are, we have different options.